Good morning. This is Karen Johnson. I'm the simulation operator for SeaStar St. Louis. I'm accompanied by Colonel Shipp, who is a physician assistant for SeaStar St. Louis.
Thank you for the introduction, Karen. This is Lieutenant Colonel Mike Shipp, physician assistant with SeaStars, and also currently director of the simulation lab located here at SeaStar St. Louis. So I'd like to kind of just do a brief introduction about what this project is all about and the technology involved with this particular project. This poses a unique research opportunity for us here at SeaStar St. Louis. I'll get into that in detail here in just a moment. What we're talking about in this research opportunity is trying to determine or validate, if you will, the difference between experienced versus inexperienced providers and or teams who manage trauma from the beginning of our 2-week program and then reevaluating the experience and the performance at the end of that 2-week program. We're going to be utilizing our experience group as senior or mid-level residents in the surgical and emergency medicine program here at St. Louis University, and then comparing that to the, quote, inexperienced group who would be our military providers coming into the course. Our hypothesis associated with this is that we fully expect the experienced teams to be, from a performance standpoint, well above the level of our Air Force personnel who are coming in at the beginning. However, by the end of the 2-week program, we expect that the performance level will be pretty much equivocal between the two groups. We're also going to be talking about the architecture associated with this particular project, what our simulation lab is going to be providing in terms of the rooms that we're going to be utilizing, what simulators we're going to use. Karen will talk in detail about the setup and personnel needed, and then also to finalize that scenario and debrief sessions. This slide, I wanted to get a point across about why this research opportunity seems like such a good idea, especially after having gone through this entire year of training with the Navy postgraduate program. We found out, since Karen and I are specifically interested in trauma, we found that yes, the value of healthcare simulation has been widely demonstrated in the research, especially if you're looking at specialties such as anesthesia and some types of surgery, especially laparoscopic type simulation. However, when you're looking at a specialized lane such as trauma, there's been very little research associated with simulation that's been done, and the research that we have found has only utilized a very small number of participants. So what Karen and I would like to do, or what we envision, is an entire year-long research project that will involve over 400 personnel being involved in this project. The SeaStars St. Louis platform administers trauma simulations to our student personnel routinely, and have done this since like about 2002. So we're well embedded into the civilian hospital as well. So this platform presents what we consider a perfect opportunity for this training evaluation, presenting this research, carrying us forward. SeaStars here in St. Louis, and we intend to utilize this potential to validate the value simulation as it relates specifically to trauma management. Again, using over 400 personnel to be involved in at least a year-long study. As you can pretty much surmise, the military is kind of unique in their their management of trauma. And obviously there is a need and a desire for advanced trauma training prior to any deployments. And in order to do that, we feel that this research and validation is critical to demonstrate, the excessive value of a program such as C-STARS. And the reason for this is becoming even more painfully clear with the budgetary constraints that are coming down the pipe. There are not very many military training facilities or military treatment facilities that allow providers to practice critical care and or trauma. But yet, in a deployed setting, they are experienced to be able to perform at the level of an experienced provider that works with trauma on a routine basis. So what we would like to do with this training program, once again with this research project we've been talking about, is to demonstrate how a platform such as C-STARS can, in a fairly short order of time, bring the less experienced providers in trauma management up to at least the level of the residents here at St. Louis University who actually practice trauma resuscitation on pretty much a daily basis. Now, this doesn't include actual performance of invasive procedures. What we are talking about here is the initial evaluation and management identification of specific injury patterns and being able to determine the right course of action as far as treatment is concerned. Here in St. Louis, our platform also trains National Guard in addition to active duty. The National Guard has a pretty significant responsibility of homeland defense and response to natural disasters and that sort of thing. So they fall into this category of needing to be spun up on trauma management as well. I think I alluded to this early on, but in the initial, simulation, the high fidelity simulation exercise that we're going to have, we're going to be comparing the more experienced or resident group to the military group, and undoubtedly, without even having started this project yet, Karen and I both have made the assumption that yes, the surgical residents will probably, carry or present a much higher score than what our military providers will be. But we hypothesized that over this 2-week course, which both teams will receive at least 2 or 3 simulation exercises, we anticipate that the less experienced over that 2-week period of time will improve their ability to effectively manage trauma, and that the capabilities will be demonstrated to be very comparable, if not equivalent to the experienced team by the end of that 2-week session. These less experienced teams will be comprised of, and this will vary depending on the demographic makeup of our student population, but typically it will consist of a nurse, a physician, potentially a physician assistant or nurse practitioner, and medical technicians who are certified as EMTs on the civilian sector. These military groups, like we said, we're very almost certain that they're going to demonstrate such significant improvement in team cohesiveness and overall trauma management that they will prove to be very comparable, once again, to the experienced teams, who will demonstrate little or no change from the baseline. The surgical residents who do this on a regular basis, their only drawback will maybe maybe be in the very initial start of this project where they need to get spun up on simulation in of itself and how the mannequin responds and the ins and outs of the fidelity situations that we'll be exposing them to.
Good morning. This is Karen again. I'm the simulation operator for C-STAR St. Louis. And I started with this slide, the students, because I wanted to reflect that they are the most important part of why we are doing this research project. The students you see in this slide are working on a pediatric HPS mannequin. They are C-STAR students, and they're working together as a team to manage this particular trauma patient. They are within a mass casualty simulation in this particular scene, and what we have here is you have a provider, a nurse, and a technician working together. This is the architecture that we will be using in our research project, and what this shows is just kind of the schematic diagram of what rooms are available to us and what exactly we will need to perform this project. We are not going to be doing a mass casualty sim in this case, but just a one mannequin sim, and that training room is, as you can see on the diagram, L003B. I, as the operator, will be working out of the control room, which is L003. The gas rack room is something you need to make the mannequin work, as we all know, and that's in the next room, which is L003A. Then, of course, you have the compressor room, which makes the gases work, the restrooms. We have an additional gases room, and then we have the debrief room where we will debrief with our Beeline medical software system in L004. This is just another picture of some of our students. It happens to be an anesthesiologist and a nurse working together on the airway of the Mediman HPS. The Mediman HPS is what we'll be using in the training room, which I had mentioned before, which is L003B. The setup in that room will contain a supply cart, which will be available right next to the litter. Then it'll contain the necessary supplies for stabilizing a trauma patient, which will include, in drawer 1, medications, in drawer 2, just some restock items for the simulation staff. Drawer 3 is airway, 4 is breathing, 5 is circulation, and 6 is your fluids and your Foley. The room will also have oxygen, a patient monitor, of which we call a ProPack, which we use in the AOR. Our people that deploy from here go over to Afghanistan and use the same equipment that we train them on here, as well as the suction and the ventilator. A fast machine is something they will also be using in our simulation, and a rapid infuser will also be in the room. This slide reflects the personnel needed to run the simulation. We will have a simulation staff to operate the simulator, such as myself. Then you'll have cadre, such as Colonel Shipp, which is a physician assistant, to evaluate the students managing the simulator. And then you'll have 2 additional cadre, which are technicians, or medics, if you will, emergency medical technicians, to act and assist as lab and x-ray. The scenario and debrief together will take roughly about 40 minutes for each group. We will debrief them with a video, and as I mentioned before, we'll debrief them in a different room away from the training room using our Beeline medical software system. This slide just reflects the references that we used initially in our research proposal. These articles helped us a great deal knowing what direction we wanted to go to in our particular research. To summarize, our research opportunity is something that we feel very lucky to have here because we're an Air Force platform embedded into a civilian hospital. So it kind of gives us that opportunity to bring Air Force and civilian together to do some research on experienced versus inexperienced trauma managers. Again, our hypothesis is to validate that our 2-week course is helping in regards to simulation in managing trauma, bringing the inexperienced up to the level of experience by the end of the course. You saw the architecture that I spoke about to include the simulator, which is the Mediman HPS, and the Beeline medical system, software system for debriefs. The setup, I mentioned the setup and how the room must be set up with what materials, equipment, and supplies will be in the room, as well as the personnel needed. Thank you.